burst out of my face.
He is one of the lucky ones. But for others who've had their face cosmetically injected, there is no quick fix when it all goes wrong. In the US, where the filler industry is tightly regulated, you'd expect the number of botches to be much lower. But greater regulations create other risks. It costs around £150 for a syringe of filler in the UK, but in America it's $1,000. The sky-high prices stateside are pushing people onto the black market, where they're being injected with cheap, illegal and sometimes lethal fillers.
You can have these injections done and you're going to die, and it's definitely not worth, saving a few $100s to have your cheeks injected with something that could kill you.
Raji Narain Singh, a 46-year-old activist from Florida, had fillers injected into her cheeks on the black market. Desperate to feel more womanly, she thought they would enhance her femininity.
I considered myself to be an attractive person. However, I felt that there was something missing. I didn't have the body that I wanted. I didn't feel that I was feminine enough. I felt like I needed more.
But she got much, much more than she bargained for. A black market practitioner filled her face with industrial-grade bathroom sealant, leaving her with a botched-up, infected face.
I couldn't afford to do it the right way. The right way being going to a certified plastic surgeon.
To save money, Raji started asking friends for recommendations for black market practitioners and was told about a local woman.
She came across very knowledgeable about what she was doing. She assured me that what she was injecting me was medical silicone. And based on those facts, I felt pretty confident that she was going to take good care of me.
But Raji was wrong.
I laid on that table in her room and she started to inject what I thought was medical silicone into me. You know the saying, beauty is pain? That day I had to literally chant that in my head because it hurt like hell. She told me that, this is normal. After she finished the injections, she would plug them with super glue. And I'm laying there thinking, oh my God, what have you done?
But once the pain wore off, Raji was delighted with the results. So delighted, in fact, that she went back for more filler in her body.
And I figured I'd work my way down. So the next thing was to get injections in my breast. And then I proceeded to do my hips and my buttocks.
But Raji's newfound confidence was short-lived. Just 9 months later, she woke up to find she'd suffered a horrible reaction to the bathroom sealant that had just been injected into her face.
When I think about that day, I get very emotional. I really do, because it was the beginning of a lot of hard times for me. The whole left side of my face felt like a huge boil. And I couldn't understand what was going on with me. And all of a sudden, this green stuff burst out of my face on the mirror. And it was just pus oozing out of my face. Just disgusting.
And unfortunately for Raji, that was just the beginning.
I felt like a monster. I'd walk out in public and people would look at me like I'm some freak. Some sideshow circus freak. That's basically how it was. Sometimes I wake up in the morning and I'm laying in my bed thinking, what did you do to yourself? What did you do to yourself? I did think about suicide. I did. So, it's been a rough road.
Since then, Raji's had 2 emergency operations, but because the filler has bound with her tissue, Now her only option is to try and soften it with laser treatment. She's booked an appointment with her plastic surgeon and hopes desperately that he can help her further. In Florida, a transatlantic botched-up body is about to get help. 46-year-old activist Raji is on her way to see plastic surgeon Dr. John Martin. She wants him to fix her filler-injected face after a black market practitioner injected her with industrial-grade silicone, normally used as bathroom sealant, leaving her disfigured and in pain.
You know, I'd walk out in public and people would look at me like I'm some freak. Some sideshow circus freak.
Hi Raji, how are you?
Dr. Martin is working to reduce the nodules of filler in her cheeks.
When I first walked in to see Raji, my first impression was just, wow, this is unbelievable what has happened to her face. She said to me, I feel like a monster, I look like a monster, and she was crying. I really felt incredibly sorry for her because she had done something to try to improve her appearance and ended up with a totally deformed face.
Let's get started here first.
Today he'll be starting her next course of treatment.
See how these nodules are doing. These are almost gone.
It's your magic.
Yeah. These were much larger and they really came out like distinct, very distinct, huge nodules that you wouldn't have been able to move them like you can now because they're so much softer.
When people have small nodules, we would just go in and take them out, but that means you have to do some sort of a surgery, and hers were very large. So what I ended up doing was an incision on one side, initially almost like a facelift incision, dissecting down under the skin and trying to take out the nodules on one side just to see if I could do this. They were so hard that I really couldn't even cut through them with my scissors. And so it was a very, very difficult procedure. I was able to take some of the substance out, but she still ended up with some residual nodules.
Okay, so I have a little bit of our steroid here.
The injection will shrink and soften the remaining pockets of filler, making removal eventually possible.
Yeah, it's still pretty hard once I'm in there. That's why it's so hard to inject. Just rub that in for me.
Beauty is pain.
Pain is beauty.
Raji is also having laser treatment, normally used for hair removal. The intense pulse light machine sends heat into the deeper layers of the skin, which softens the lumps of filler. After a number of treatments, the filler should rise up through the face tissue to the epidermis, just below the skin. Once there, it can be removed.
As we start to shrink down these nodules, the question is what's going to be left in there? Is the muscle gone? Is the fat gone? And is she going to then be hollow and depleted? Then we have to figure out another way to sort of fill it in to look smooth.
Unfortunately for Raji, there's no quick fix, and she will have to endure many more treatments before she can even begin to get rid of the bathroom sealant that's left her face botched. But she can at least be thankful to be alive.
The woman that injected Raji is also now up on manslaughter charges for one of her patients who died after her injections.
My message to anyone out there who may be considering going for these black market injectables, don't do it. Don't do it. Because you can end up dead, or you can end up like me.